Hi there, everybody. Talking about Planned Parenthood and the plans to defund Planned Parenthood. There's reactions across the United States on this issue. And I'm talking about two reactions, one from a Minnesota paper and then another from a Des Moines, Iowa paper. So the Minnesota paper is St. Cloud Times. And they're saying that there's been letters to the editor, with some saying like Planned Parenthood is an abortion business. And so there's corrections in response to this misguided statement. So Planned Parenthood actually provides access to birth control, which is not abortion. It's contraceptives such as shots, patches, basic IUDs, condoms, all kinds of birth control methods to prevent pregnancy in the first place, which is not an abortion. They're two different things. Planned Parenthood also provides family planning information on, in addition to those contraceptives, on how to, just in general, if you do not want to get pregnant, the ways and the methods that you can use to not get pregnant, which is not an abortion service. Planned Parenthood also provides testing on every conceivable thing that you can get tested on when it comes to family planning and reproduction and general health and maintenance on reproductive organs. So, testing for fertility, things like that, any kind of disease or infection, things like that. Even just to test if you are pregnant, they provide those services. These are not abortions. It's something else different. It's not an abortion. And so they also don't just test for diseases and infections. They also test for cancer and tumors, breast cancer, uterine cancer, ovarian cancer, cervical cancer, anything that might go wrong. Planned Parenthood helps to find it and identify it, and then also treat it or make referrals. And so it's an early detection system for killer diseases that might have repercussions in terms of fertility, sterility, and death. And so Planned Parenthood does that too as well. These are not abortions. It's something else. Also, they do just general pap smears, just to yearly, just to see if everything's in order. Like when you take your car into the shop to get a tune-up, to get oil change, things like that, maintenance, things like that. These are not abortions. Something different. The federal government does reimburse for these services through Medicaid or other ways. So the federal taxpayer money that does cover these issues. Through the Hyde Amendment, no money whatsoever from the federal government, from the taxpayer, goes to abortion services. Some people seem to think that it does. The Hyde Amendment does not allow federal funding to cover abortion services. So the question you need to ask yourself is, why is Paul Ryan and other members of the Republican Congress attacking Planned Parenthood when Planned Parenthood does not use federal funds to cover abortion services? The effort to defund Planned Parenthood is not to stop abortion services because they don't use that money anyway for abortion services. The effort to defund Planned Parenthood would eliminate tests for cancer, tests for tumors, tests for infection, tests for disease, tests for pregnancy, tests for general breast exams, testing, or also access to contraception, birth control pills, the patches, the injections, condoms, IUDs, things like that. Also, education classes. That is what the effort to defund Planned Parenthood accomplishes. So I'm going to post a link to this article because it goes through that. And then also the idea that some members of the Republican Congress are saying, and some state legislators are saying, that women can just go somewhere else. No, they can't. There is nowhere else. Planned Parenthood covers and is the provider for the majority of women. They have the clinics, they have the personnel, they have the supplies and equipment. That's why people go to Planned Parenthood. They are the clinic. There is nowhere else. People have listed out, well, you can go here, you can go here, you can go here. And people follow up and investigate, and it turns out that it's a dentist office, that it's an eye exam clinic. People are just throwing around names like, you don't have to go to Planned Parenthood, you can go here. Planned Parenthood is the major provider of these types of services. This is where women go. And so, again, we have to ask the question, what are they really trying to accomplish? What is the real goal here? Because what is the result that's happening is women are losing access to healthcare that they really need, that can actually prevent them from dying. And so why would someone do that? Why would someone say, well, we won, we succeeded, mission accomplished on actually targeting women for attack? And it's kind of not making sense to me because I'm not a man and I understand the thinking on this. I really don't. I'm trying and I just don't get it. And I'm just wondering if it's a type of, I don't get it. I really don't. Maybe someone can sign in and just say, like, the reason why we don't want women to have access to tests and preventative treatments and birth control is this. Because I just can't imagine why. I'm just really puzzled. Help me out here. Thank you.